Endometriosis, treating severe pain becomes a pain. You cannot end up removing the whole endometrial tissue in these group of patients. See, a lot of times people think about removing the uterus also, but I think it is not removing the uterus that is important. At that point of time where you're sure that you've finished your reproductive life, at this point of time, sometimes removing the whole ovaries, bilateral ovarotomy, if you're no more looking at a child, or if this is your only concern, completely removing the whole both the ovaries probably is the only way in which we can cause a surgical menopause, where you completely remove all the hormones in your body and cut it off, so that there will be no more hormones or no more endometrial, because all the whatever, to a certain extent, how much ever you do or treat it, there is always, even if you remove, how much ever you remove it, there's always a possibility that some tissues of this endometriosis still get stuck remnant onto the ovaries. So whenever we talk to a patient regarding surgery for endometriosis, we should also tell them that it does not necessarily mean that it is completely removed with the surgery alone. I think this is something we should always keep in mind, that see, we are removing the uterus. Okay, does not mean that all the endometric implants are on the uterus. Your menstruation is stopped, but the ovaries are still there. There can be other remnants of the endometriosis all around. So, and sometimes with so severe adhesions, we cannot remove everything that is adherent. So in these kind of situations, yes, a lot of people, even after surgery, will continue to have pain, and probably we'll have to go for some, again, other painkillers and other form of treatments in these group of patients. So removing the uterus does not always mean that your pain is completely gone. Yes, there are a small group of patients who will continue to have the pain, because so in this group of patients, probably if you're removing it for the pain, if your family is done, it's actually removing the rather than removing the uterus, what is important is removing the ovaries both sides, because that is what is actually contributing to the estrogen, and that is causing the increase in the endometriosis. The possibilities of scenarios where we end up removing the uterus is primarily in patients with adenomyosis. The same endometriosis can infect in the walls of the uterus and cause a disease called as adenomyosis, which can be the reason. It is nothing but because, like I said, imagine having a small cut in your hand, you have blood coming out from the hand, and you actually keep your other finger on top of that wound, leave it for some time, and then you realize that your actually finger gets stuck into that particular point. We have the power at this point of time to remove the hand and remove the finger and make sure that it does not get stuck to each other. But what happens inside your abdomen, where actually you end up having bleeding, and these things get stuck onto there, things become more and more difficult. It keeps on getting more and more adherent over and over the time. See, a lot of situations in this is that even if the tubes are not blocked, you end up having infertility, because what you should understand, the tubes and the ovaries needs to be freely mobile, so that the ovum pickup happens very clearly, so the sperm can enter the tubes and the ovum is picked up by the tube and it gets fused inside the tube. But what happens when the adhesions are there means the tube, even if it's not blocked, it's because it is stuck somewhere, it is not able to go and pick up the egg which is released from the ovary. Just imagine, like, you have a hand which is functioning, but if your hands are tied, then the purpose of the hand is lost. Similarly, in endometriosis or some kind of adhesions which is causing the tube, because of all these adhesions, there's a possibility that the tubes will get blocked and the tubes will contain some kind of a fluid. And when we are doing IVF in this group of patients, there's a possibility that the fluid which is there in these tubes will flow into the uterus and prevent the embryo from catching. So that is one possibility in cases like this, where there are repeated IVF failures, is to look for something called as a hydrosulfings or fluid inside the tube, which can reduce the chances of implantation in this group of patients. Yes, IVF becomes a major treatment in this group of patients. Another thing what we should always understand and treat in this group of patients is that in a patient with endometriosis, when you're planning for a surgery, what you should always understand is, for infertility, we should make sure that the patient does not have any other problems. For example, the patient's semen count is bad, or patient has got some other tubal problem. Correcting your endometriosis will not see, the whole idea of doing a surgery for endometriosis and infertility is that you want them to get pregnant normally after the procedure. If there is already issues which is going to prevent them from getting pregnant after the surgery, then there's no whole point of doing a surgery is lost. By doing a surgery, probably the only thing that we are doing is reducing her ovarian reserve or reducing the number of eggs that we are going to get in this group of patients. So if there are multiple issues, rather than going for surgery in patients with infertility, I would rather suggest them to go directly for IVF. But does not mean you have endometriosis that you go directly for IVF. You have to actually try normally. With very severe disease, there are possibilities of you getting pregnant. So it is very important. A proper trying time is very important as far as endometriosis and treatment is concerned for infertility. Because today I feel majority of the time people not getting pregnant is because they're not able to try for it properly. If they're able to try for it properly, they somehow get pregnant. There's always this mathematics that we always tell our patients. See, 2 plus 2 is 4. 3 plus 1 is also 4. What does that mean? It basically means that not necessarily both your husband and wife needs to be very perfectly all right. There's a possibility that sometimes the sperms are so good that even if females with some difficulty will get easily pregnant. Similarly, the females are so fertile, even somebody with low sperm count also get pregnant. So you can actually look around and see around. There are a lot of people with endometriosis getting pregnant normally. There are a lot of patients with PCOS getting pregnant normally. If you take all the men who make their wives pregnant and take the semen and see their semen count, probably a lot of them will have a little inferior quality of semen. So there are a lot of factors as far as getting pregnancy is concerned, and all together will only increase your chance of getting pregnancy. Because similarly, so trying for a pregnancy is very important. Currently, that is the biggest challenge that we are facing. We have to tell our patients to actually go back and try, and we are forced to do treatment in these group of patients because they don't have the possibility or they're not able to try because of their work and other pressures. To be very honest, again, we have contradictory reports regarding these things. Initially, what they say is that the egg quality is not initially affected, but as the disease progress and over the time, you end up having severe forms of multiple surgeries. In those kind of situations, your egg quality can be reduced. So that is one of the reasons that after having a reasonably good trial time and after initial treatment, if the patient is not getting pregnant, it is important that before it is too late, before other factors come into play, before other factors like age, which will again coincidentally reduce the quality of eggs, all come into play, we can always increase or somehow get them pregnant as soon as possible or move to IVF in a much earlier stage in these group of patients so that they can get pregnant faster. I think it all depends on how many number of IVFs that just because the patient see. I think whenever we do an IVF does not necessarily mean one IVF failure does not mean that there is a problem. I think what you should always understand or talk to your patients is that there is a 50% chance for you to become pregnant with an IVF in the best cases in the best patient. So in patients who are once becoming failure does not really mean that there is a major issue. So one time failure or one time IVF getting failed is not a major reason. You should always not consider that there is a major issue that is there. But when you're doing repeated IVF cycles, you realize the number of eggs that you are getting is less, or the quality of eggs or the quality of embryos that is developing out of that IVF cycle is less. Yes, probably that is a time when we talk to the patient and tell them, yes, this is time for you to move into an option of donor egg IVF, because at that point of time we understand that the donor egg is the egg is the most important factor as far as getting pregnancy is concerned. If the issue with that, probably your chances of getting pregnancy will decrease. Today we have started doing this AMS test for a lot of people, and it is just basically tells us the overall number of eggs in their body. If the overall eggs in their body is less, basically will tell us that yes, the time taken for them to get pregnant or the amount of time they can actually try for a pregnancy is lesser. They might have to do some active treatment and get pregnant as soon as possible. Unfortunately, no. AMH, just like how, see, it's like this, God has given you a number of eggs in your body, as far as females are concerned, and once their menstrual cycle starts, every month they will start keeping on losing eggs, and that overall bank account, the number of eggs that is remaining in the ovary, is what the AMH is relating to. And as the eggs keep on going out every month, and it reaches a point where it's completely out. So AMH tells us tentatively overall number of eggs that are there inside our ovary, which can be used for future. So we do not currently have any medicines to increase the AMH. As of now, we do not have any proven way to improve your egg quality. The only way we have different kinds of nutritional supplements that you give and hope and assume that it is going to work in this group of patients. But one thing that what you should always understand or see is actually that if sometimes the more the number of time you do some kind of a treatment, or the more the number of times you do, there is some point of time that there's one good egg will come up and you end up getting pregnant with that egg. So sometimes your perseverance or doing it more and more times will actually help you in getting pregnant as soon as possible. I think that getting one IVF negative or two IVF negatives is never a major concern, but you should always understand what has happened during a cycle, why you would sit and talk to your patients. One point I always tell my patients before you start a treatment, when we sit with our patient before, why are we doing this treatment? What are your options? What is the success rate in you? It's not that you have a 50% success rate in your lab, does not mean the patient will have the same success rate. The success rate depends on patients. So in that particular patients, if you are doing an IVF, what is the success rate they should expect? What is the cost of the treatment? How is the treatment done? So all these things should be very clearly understood, because a lot of these patients actually after the procedure, what happens is they get so dejected even after the one IVF failure, and they just stop treatment for a very long time. They come back after several years saying that, okay, let's do the treatment again. But during that long period of wastage, you end up losing a lot of this good time that you can actually do the treatment when you have good quality eggs to come in, and all that time we are actually ending up losing. And thank you so much for your patience here.